Welcome to Wisdom in Dentistry. I'm Bear, and I'm here with.
Hello, everyone. I'm Maria. We're both excited to share the do's and don'ts and give you the amazing insights that make a dental practice thrive.
Absolutely. Our goal is to help your practice grow, create a happier environment, and bring the most fulfillment into the dental world that we love.
Yes, so let's jump right into and get started.
All right. So today we're talking about the power of words in the dental practice. And the first thing that comes to mind for me is how our words impact our patients' experience in their appointments, from the moment they walk in to how we present the treatment plan, which is a crucial part, and also how we check them out and guide them towards scheduling their next visit and answer any questions that they have. What thoughts come to mind for you, Maria?
It's a wonderful topic, Bear. I'm so happy that you wanted to talk about this because it's the number one issue happening today at dental offices, the lack of engaging with the first person that makes the contact with patients. You can't really blame them. They're just being themselves. They're happy to help. They're busy. They just don't know that one simple word or a phrase can kill the trust from a patient. I was in an office not too long ago, actually a few days ago, where this older lady shows up to her appointment earlier, and here's a front desk office manager, um pretty much said it very cold. um I tried to call you, and I could see the older ladies kind of saying, oh, well, I don't know, maybe my cell phone was
Yeah,
not on. But so, you know, just in that, I can tell you, and I told the owner right then, that's not the way to approach. Did the manager said something wrong? No, she was very truthful. It's just the way you say things.
yeah. Yeah, because in a situation like that, we want to point the finger somewhere and shift the blame just because we're uncomfortable with thinking that it's our fault that this happened, right? But in that situation, like I feel like I would have said, "Oh, I'm so glad you're here. We have you scheduled on, whatever other date if that was the case. But let me see if we can work you in to the schedule. Even if you already know that it's not possible, just the fact that you made an effort or a perceived effort, it would change their perspective of who we are as a business, like who we are as a dental practice. And then maybe go back in there and, check your schedule, talk to the doctor, see if there's a way. And if there's not, come back with an apology and be like, I'm so sorry. Sorry for the mix up. I'm not sure what happened, but we can resolve it. And
Yes.
what we can do.
Yeah, and I think right away, as you said it right, is not the reaction that patients are expecting. So if you're absolutely right, you did call that patient. The patient is still someone that we welcome, we want to serve, we want to bring on board, especially an older lady. They're the best marketing tool you can have. They tell everybody in their family when they love you, when they have an experience. They're the best people I want to treat. So there's nothing that will, make you in trouble if you use a little bit of a different technique and say, oh my God, let me verify if I have the right number.
Right.
Maybe I did dial wrong because I did try to contact you. Perhaps I didn't call the number right, because it happens too
Yeah.
that we make a mistake. Maybe the number is not correct in the system. Maybe you misdial at some point, and you know that is not the way. So I think the communication, the wording, and a lot of times, as a coach, I'm being told, Maria, I'm not like you. I don't have your personality. I cannot come with all these
And
creative, and I don't do scripts well because I don't like to be reading. I don't sound like myself. And that's where the coaching comes, because of course you need to be yourself.
mhm.
Of course you need to be you, and you need to really understand the concept. Once you understand the concept, your own words will flow.
Yeah,
It
the
doesn't have to be the script. I know some companies are very, very specific. You need to learn the script. But when I'm teaching a script, I like to do the role play until the person feels it. And then they use their own words, and then they come across so genuine. And sometimes, you know what? They're so creative, they even come with a better word than the script.
yes.
And I tell business owners, let them. That script is actually better than the one we put together.
Yeah, and that's what it's all about, like you said, feeling the message that we're trying to convey. Saying it in your own words, but having that same tone, having that same level of customer service that the script brings you. Because without the script, you may come across, yes, as yourself, but as yourself talking to your buddy, as yourself talking to the way that you talk to your mom, maybe, I don't know, which is not the same way that you will talk to a potential customer, to a patient. You have to have that little extra TLC when you're talking to the people that you want to bring into your practice. So the script brings you to that level of thinking and communicating. And then once you get there, you can absolutely put in your own words. You can absolutely tweak it to make it more you, more personal. And yeah, we all want to talk to somebody that's being exactly themselves, not to like,
Mhm.
we don't even like talking to AI. We definitely don't like talking to a human that is reading off a script. So
Yeah. I always like to say, I will never forget one of the first dental conferences that I took many, many, many years ago, where I'm expecting to be very serious, and I'm expecting like get on to the business side and teach me. I was not expecting to be talking about my emotions and how I felt and what. I didn't sign up for a spiritual growth seminar. I signed up for a dental conference. But it taught me so much, and I started combining that with my coaching. If you're not happy at the workplace and you're not able to somehow manage that, it will reflect in the way you conduct yourself with your patients, with your coworker, with everybody, period.
mhm.
So what I see at times in dental practices is that, you know, the front office should want to do back office, or the front office wants to do other things, or now I'm the manager and now I have to be in the front. And, I can see it, sense it. So it reflects,
Mhm.
because I also have seen um, all kind of personalities. Even the most don't talk to me. I like paperwork. I don't want to be. When they're happy and they have to cover the phones or they have to cover the front, they immediately transform into someone else. And I have seen it, and that's the most wonderful. And I'm always there, like, oh my God, waiting to give them the compliment. How do you pull that together? And she's like, well, I hate being there, but I know once I'm there,
Yeah.
I need to be happy and polite to my patients,
Yes.
because she knows if she doesn't have patience, she doesn't have anything to build.
Yeah, and I would much rather have happy conversations with patients,
Yeah.
confrontational conversations with patients. I mean, if you're the treatment coordinator or the insurance person or the billing person, then you have your tone is a little different. Good, but when you're that front desk person and you're attracting happiness, attracting the best version of your patients, because that's what we want. We want them to come in and be happy and feel comfortable and so on, get their treatment done. And then when it comes to finances, they go to another person or another version of you, because it's a different type of conversation that, more serious conversation that you're having. But I wanted to talk about um, one very important key phrase that I always teach when I do trainings with an office. which is for scheduling appointments. Like, and I'm talking about when patients are walking out, they're done with their visit, and we need to schedule them always for in a general practice for their next hygiene appointment, whatever that may be, and for their next treatment appointment, if there's treatment pending. So I often come across practices that where the receptionist is saying, "Do you want to schedule your next visit?" That's super common, and it's a tiny little tweak that I give them. Instead of saying, "Do you?" which is a yes or no question, ask, "When is a good time for your next appointment?"
Mhm.
Especially for treatment. You've already discussed the treatment plan, sorted out the finances and everything, and then there's that kind of gap of from agreeing to the treatment to getting it actually into the books, because sometimes that's a really big moment when the ball gets dropped. So after they sign their treatment plan and so on, when do you want to schedule the appointment? When is a good time for you? Make them pull out their book, make them pull out, their schedule, their whatever, their phone, and figure out when that time is. And then if they say, "Oh, I have to ask my wife, I have to look at my work schedule or whatever, I'll get back to you," I always tell them, "Why don't we schedule you for a tentative time,
Mhm.
a week from now or 2 weeks from now, and if it doesn't work out, just give us a call, we're always happy to change it." The point is to get the patient to schedule that appointment in the books, even if it's tentatively. Most of the time, it just stays there because it really is not a scheduling issue. It's just more like a hesitation, fear issue of whatever else. But once they're in, it's less likely that they'll drop out. What do you think?
Oh, I that's exactly. So anyone there that has been into under my coaching or had taken whatever seminar, exactly how you're saying it. But I add to something for perspective.
Mhm.
In the dental world, we're a bit behind in confident versus the medical world.
Yeah.
So I always ask whoever I'm training, teaching, when was the last time you argue with your medical provider for whatever procedure you're doing on
Mm.
the next appointment?
Yeah.
Almost never, period.
Yeah.
Even if you are a single mom, you have to work. If you have, uh, you're a dentist yourself and you have patients to treat. If it's an urgent or if it's a process in the medical field that requires you to have a lab, to have an exam, you go.
Mhm.
You don't wait
Mm.
to tell them, let me get back with you. The issue that happens in the dental industry still today is that we don't put value into what we're doing. We don't put value into the diagnosed. So patients feel that. And when there is no value, then there is no shows. Then there is a lack of trust.
Yeah.
Then there is the, oh, I do that later. Because when there is value, so I in recare appointments, I always put that into the clinical team. I think if the clinical team can assist the front office, is a game changer. Because if the hygienists or the assistants are the ones booking that appointment, as you described with confident,
Mhm.
is I will add, you said when is a good time. I will probably add a little more and say, does Tuesday like today at 4 o'clock works great?
Yeah.
And boom, I go to my 6 months on a Tuesday at 3 o'clock because you're here on a Tuesday at 3 o'clock.
Yeah. Exactly. Exactly.
Oh, I think that June I'm going to a cruise. I'm not sure yet. My husband is trying to plan exactly what you said. Let me book you for June 15 at 3 o'clock on a Tuesday. And you're more than welcome to call my friend so and so, which is the front office person, or if you're using an outside, you can contact our call center and let them know. They will be happy
Mhm.
to. Now, if I am in the front and I know it's about time for my patient to be leaving, I go into my system. I already know there is an appointment, so I will be there. I see you on June 15.
Yeah.
So the entire team is engaged with me as a patient.
Right. Right. Yeah.
And it's not difficult. It's not.
That is the reason why we have these softwares. That is,
Oh, yes.
we're not flipping through the book anymore. That's the reason why we have everything at our fingertips, and it's so important. And that's probably another conversation, but it's so important to be able to utilize it to its full potential, or close to, so that we can, as the patient walks out, click, click, click. Oh, they're scheduled already. See you next time on whatever day, and that, as you said, it engages the experience so that the patient knows everybody's aware of what's going on. It brings cohesiveness to the team, and it reminds them also that, hey, I'm gone, I'm leaving now, but I am scheduled to come back. And if that's not a good time, because I do this often, whenever patients checking out or so on, let them know what their next appointment is, and then, oh, actually that's not a good time, or actually I'm going to be out of town that day. Let's go ahead and move it, and then you avoid a last minute cancellation and so on. Yeah.
What happens if the patient is completely hesitant? Maybe I'm losing my patient. Maybe the patient is somehow halfway out because they haven't really liked the practice, or somebody else told them about a better practice, and I can sense because they're giving me resistance. It doesn't matter what I say. They're like, no, don't book the appointment. I will ask to my patient privately. I can sense a hesitation. Is there anything you want to share with us?
What?
Because we care. I
Yeah.
know my manager care. I know the doctors care.
Yeah.
If you open the communication, at times patients will say, yeah, well, I took my son to this orthodontist, and, I'm hearing, and they tell you that story when they're pretty much saying, yes, I was giving you resistance because I'm not sure if I want to come back.
Mhm.
Or at times they will say, well, I really didn't like the cleaning experience I had today. Or
Yeah.
I really didn't like, the doctor. Whatever. If you open up instead of, getting into this back and forth, again, the communication is a class, is a coach on his own. And
That,
it's also practicing, and it's also a culture changing.
that's so valuable, because oftentimes patients are hesitant to voice those concerns. But, to us, we know that it's okay. We know that people have preferences. Like, oftentimes I see patients that came in with a hygienist. They really were not their cup of tea, and so on. Everybody vibes differently, and it's okay to have your preference. But sometimes they feel like they can't say it because they don't want to hurt your feelings, and so on. But if you open that door and say, hey, do tell us, because we care, we want you to have a better experience, then they might be more compelled to actually say it. And then we can fix it. Because if they tell us, I don't like my hygienist, we can schedule them with another hygienist.
Exactly.
And if we get enough of those, I don't like my hygienist for a specific person, then we can, that feedback also helps us as a team to address any concerns, like if she's being too rough, or if she's, talks too much, or whatever it is, we can actually give that feedback to that individual so that they can, you know, adjust.
Yeah. I think that the communication, there, it also combines with what you said earlier, how well they're using the system. I've been to practices where they swear they're using the system to the T, everything is so good. And I had been in the front desk observing, and then I realized the patient's birthday is that day. And I'm like, oh my God, happy birthday today. And she's like, oh, thank you. And then everybody's looking at me. The patient just was in the back for 2 hours doing a, same day crown, whatever. And everybody missed the birthday. So at the end of the day, we always have to remember we are consumers.
Mhm.
And don't we love when someone remembers even the little thing, right? Like Oh my God, are you gonna have the same drink as last time if you go to a restaurant? It doesn't matter if it's fancy or not. If the waiter remembers you and remembers what you like,
Mhm.
oh, no ice, right? You don't like ice. Whatever little things, are you putting the same color, Maria? Are you doing whatever it is that someone remembers, whether they read it in your file or they genuinely remember you? Don't we all feel great? Sometimes those little comment changes our day,
I love this.
right?
Yeah,
So why not thinking every patient is coming there and they might love to hear a little tiny bit of something that shows them that you were waiting for them and that
and
you wanted to see them again.
I feel like this is the part that builds that loyalty with patients, because they will be more likely to come back to the place where they already know about their kids' extracurricular activities. They already know what's going on with their life. They already know their favorite polished flavor, the perfect paste flavor, and so on. And they would value that over starting over in another practice where they might not get the same personalized attention. So tying that to the part where we talked about knowing the system, in Dentrix and many other practice softwares, they have this too, the patient notes section. A lot of people use that for different things, but that's exactly what that notes section is intended for patient, like personal notes, patient notes about themselves, so that whenever the patient comes in, we can circle back to that and say, oh, she likes going to Hawaii every summer, or whatever. She's got 2 kids and a dog, and they love their dog, or something that relates to the patient. And when they come in, you can ask them, hey, how's your dog? Or
Mhm.
and anything at all that is unique to that patient. And they come in, you'd ask them about that, immediately their face lights up. Immediately they feel right at home. Immediately
Yes,
they feel like they belong, which they do in your practice.
yes,
But sometimes we have a hard time creating that relationship.
yes. The one that I hear, and I still hear it. I'm in the front observing, and then this phone rings, and then, sweet, nice. No, we don't. Oh, okay. Well, thank you so much. Okay, have a wonderful day. Bye. And I turn and I tell the doctor, whoever is there, here's, 2,000, 5,000, 10,000. We don't know. And then they're so genuine because I love that.
Yeah.
I'm sorry, who was that? Oh, they asked for this insurance company that we don't take. Which one? Oh, I cannot even remember, but I know we don't take it. And it's a sad moment because we all should be curious to know. So
Yeah.
do you take A, B, C, D insurance? Oh, I'm sorry, I we haven't really heard, but tell me more a little bit about your insurance. And I can let you know. But so we treat a lot of patients here. We love to have you. We don't treat the insurance companies. So let me see what I can do. Engage into a conversation. Well, ABCD is a new plan. I don't know. I will figure it out. And if it's a plan that okay, your office doesn't take, then the dismiss of that patient should be um, please flip your card or get into your portal, look at the dentist that you're assigned. You're more than happy to go see them. Your insurance will, the office, I'm sure, will explain your benefits. But guess what? If you're not happy, you always have the choice to come here and be a cash paying patient.
I have reeled so many HMO patients back into the office
Yes,
by having those conversations on the phone, because they just don't know what they don't know. They don't know that their HMO plan or their whatever low reimbursement plan that they have is not paying a fair fee to the dentist. And that's why they're having a hard time finding a quality dentist. That's why they're shopping around. If they're calling and calling and they can't find somebody, I tell them the reason. Like I go deep with them. And I do it out of the kindness of my heart, because this is not even a patient in the office. I'm not, we're not yet making any money from this conversation. I am just doing it to shed light on the issue that they're having. And if they tell me, oh, HMO plan is a perfect example. I have Delta HMO. Do you take that? And I tell them, you know what? The HMO plans actually work a little bit differently to where, and I explain it, the office only makes a certain amount per every person that's assigned to the office. And that certain amount is probably going to be like $5 or $10 at most. It's not worthwhile for the dentist to take the plan and do quality dentistry on the low reimbursements. And then the light bulb goes off. Oh, maybe I should change my plan, if they have the option. Or if they're not able to change the plan, I introduce our loyalty program. And when you introduce that and they realize that they would pay less for the membership program than they pay for the HMO, and it's more worthwhile and there's more benefits, then easily they cancel their HMO. I've seen it happen over and over and over. They cancel the HMO, come into your office as a cash patient. There's no billing of the insurance. They just sign up for your membership program, and boom, you have a patient, another mouth to go out there and tell their other HMO friends to come to this office, and they're getting quality dentistry.
Yeah.
And that's the power of the word. But if you're not willing or or if you just don't know how to have those conversations with the patients, then your front desk is leaking revenue, you know?
Yeah, and an amazing explanation. But let's say they might not have all the time to explain to patients the concept. It's about becoming, welcoming to the practice, because again, that person is going to, keep you in their reference. Let me know if you can. If you're not, you can always call back. So I'm helping you,
Right.
right? I'm telling you, because at the end, we respect every plan. We respect, what they're doing. We're here. If you contact us, something. So I will be curious to find out what made you call our office. What was appealing?
Yeah.
That's a marketing. That's a tool that the doctor or the leadership team wants to know what is making that patient call. So if I'm the one that receives the call, I should always be curious to find out what made them call us,
Right.
regardless if that patient turns to be a patient, established patient in your practice. So the final thoughts and the recommendations, if you're a front desk person and you don't have any exposure to training, be curious. Start with knowing who you are, what's your personality type, because that helps you to also get into more um, YouTube videos that are related to your personality. It's hard to learn when I don't relate. So find out what is your personality traits, what are the things that you like if you're interested in becoming a better communicator. And then after that, bombard yourself with, and if you are brave, tell the doctor, I would love to join a seminar. I would love to pay for a class. Invest in me. I'm all investing in you. I love this practice. Send me to a seminar. Have that craving and learning, and then you will tap into becoming more confident um, with your communication. If you're totally not interested in that, I'm sorry to say, but I will say then tap in trying to be a better person if you want to engage with other people.
Yeah.
Because no one wants to come to a place and find a long face or hear somebody rude on the phone.
Yeah.
So if you're not interested in polishing yourself and learning more about how to become a better communicator, then tap into, how do I become happy at this job? Even if it's a 2 months, even if you're thinking I'm looking for another job, I don't like it, then do something that makes you happier in that position. Because if you are in the front or you're answering the phone, you better be interested in people and how to communicate in a neutral way so it flows.
Yeah. Otherwise, you might
And
be.
doctors, please invest in that. Invest in your team.
Absolutely. And I would just add to that that realizing the power that our words have in our job is absolutely the first step. Just knowing that, hey, whatever I say in this conversation with this patient has a huge impact on the outcome that's going to come of it. If you're a dentist listening to us, whatever I say in this clinical exam is going to have a huge impact in whether or not this patient schedules. If you're a dental assistant, whatever I say in this handoff, when you bring the patient to the front and discuss with the front what the findings were, whatever I say to that person is going to have a huge impact on whether this patient schedules their treatment or not. So, first of all, if nothing else, realize the power of your words, which is to build or to destroy. And as you said, reach out for training, self-help. There's lots, as you said, there's lots of information on YouTube. We also offer training through our company, Dental Revenue Guard. So if you're ever interested in a one-on-one training, feel free to reach out. We'll leave the information down below. And yeah, thanks for joining us on Wisdom and Dentistry. I'm Bear.
And I'm Maria. We love having you with us. And we hope you're leaving amazing ideas for your practice. Thank you all.
Until next time.
Until next time.
Smiling.